So, good day everyone. So, after the discussion of social cognitive theory ni Bandura, now let's proceed to the discussion of the social learning theory of Julian Rotter and Walter Mischel. So, as an interactionist, Rotter believes that a person's behavior is influenced by their thoughts, past experiences, and expectation for the future. This is different from another person mentioned, who is Skinner, who believed that behavior is mainly shaped by their environment and reinforcement. So, who is Julian Rotter? So, Julian Rotter was the author of the Locus of Control scale and born in Brooklyn on October 22, 1916. He was the third and youngest son of the Jewish immigrant parents, and Rotter identified himself with Adler's description of the youngest child who is very competitive and always ready for fight. This means that he saw himself as someone who is always striving to be the best and is not afraid to stand up for themselves in challenging situations. Ruther's family was doing well financially before the Great Depression hit. During the Great Depression, Ruther's father lost his business, and the family struggled to find work for 2 years. This experience made Ruther realize the impact of social injustice and how internal situation can influence how people behave. So, as an elementary and high school student, he was an avid reader or sering pa bookworm kuno. He read nearly every book of fiction in the public library. That being the case, he turned one day to psychology shelves where he found Adler's, Freud's, and Carl Miniger's, correct me if I'm wrong on pronunciation, book. So he was particularly impressed by Adler and Freud and soon returned for more. So to make it short, when he started at Brooklyn College, he initially had a strong interest in psychology, but decided to major in chemistry due to its perceived better job prospect during the 1930s depression. So, while at Brooklyn College, he discovered that Adler taught medical psychology. He attended Adler's lectures and clinical demonstrations, leading to personal acquaintance with Adler. And Adler then extended an invitation for him to participate in Society for Individual Psychology meetings. So, Rotter graduated from Brooklyn College in 1937 with more credits in psychology than chemistry, who is an major course. He pursued graduate studies in psychology, earning a master's degree in 1938. Ruther completed a clinical psychology internship in Worcester State Hospital in Massachusetts, where he met his future wife, Clara Barnes, and in 1941, he obtained his PhD in clinical psychology from Indiana University. So, after World War II, Ruther took a position in Ohio State where one of his students is Walter Mischel, where he became the dominant member of psychology department. However, he is not happy with the political effects. So, Ruther moved to Connecticut and took the position as a director of clinical training program until 1987 when he retired. And recently, on January 6, 2014, he died at the age of 97. Now let's move on to Ruther's social learning theory. So, Rotter's social learning theory has basic five assumptions. And the first one is human interact with their meaningful environments. It means that how we respond to things is not just based on what we see, on what's happening around us, but also on how we see and interpret those things. The second one is human personality is learned. It means that our personality is not something we are born with, but rather something we learn and develop over time. This means that our personality is not fixed or set in stone at a certain age and can actually change or be adjusted as we continue to learn new things. And the third one is personality has a basic unity. Rotter believes that personality stays consistent over time. This is because we tend to learn from past experiences and use that knowledge to guide how we react to new situation. The fourth one is motivation is a goal directed. Rotter believed that people motivated by goals they want to achieve rather than just trying to reduce tension or seek pleasure. And the fifth one is people are capable anticipating events. This means that people can predict what will happen in the future. So, these five general assumptions, Ruther built a personality theory that attempts to predict human behavior. So, how we predict behavior? In predicting specific behavior. So, there are four variables in predicting specific behavior. The first one is behavioral potential. The second one is the expectancy. The third one is reinforcement value. And the fourth one is psychological situation. Now let's discuss first the behavioral potential. So, behavior potential is the possibility that a particular response will occur at a given time and place in a relation to its likely reinforcement. So, it means that refers to likelihood that a certain behavior will happen in a specific situation. In simpler terms, it's the chance that someone will do something in a particular place and time. So, example, you're walking toward a restaurant. There has several behavioral potentials, like you might pass by without noticing the restaurant, or actively ignore it, or stop to eat, or pwede liwat think about stopping to eat, or etc. So that is behavioral potential. Next is expectancy. So expectancy refers to a person's expectation that some specific reinforcement or set of reinforcement will occur in a given situation. So in simpler terms, expectancy is all about what we expect to happen in a certain situation. Example, if you study really hard for a test, you might expect to get a good grade as a result. So this expectation of a positive outcome is what expectancy is all about. So when we talk about expectancy, we're talking about what we think will happen as a result of our actions or the circumstances we're in. And the next one, so there are two types of expectancies: the general expectancy and the specific expectancy. So, general expectancy are learned through previous experiences with a particular response or similar responses and are based on the belief that a certain behaviors will be followed by positive reinforcement. So, when we say general expectancies are beliefs we develop from past experiences that a certain behaviors will lead to positive outcomes. So for example, if a college student has worked hard in the past and received high grades as a result, they will likely to believe that working hard in the future will also lead to good grades. So, ano naman ang specific expectancy? So, paano siya nagkakaiba sa general expectancy? So, specific expectancy are designated as E prime. So, in simpler terms, specific expectancies are beliefs about what will happen in a specific situation. These expectancies are influenced by both the general belief and the specific belief. For instance, a student may believe that working hard in general will lead to good grades, but they may also believe that working hard in a specific class like mathematics may not be rewarded in the same way. So, matanan, general expectancy and specific expectancy. And now, let's move on to reinforcement value. So, reinforcement value is a person's preference for any particular reinforcement over other reinforcement if all are equally or likely to occur. So, reinforcement is a factor that affects how likely someone is to do something based on how much they like the reward they'll get. For example, if you have a choice between getting a piece of candy or a sticker as a reward, your reinforcement value will depend on how much you like the candy versus how much you like the stickers. So, there are two types of reinforcement value, the internal and external reinforcement. So, the internal reinforcement is the individual's perception of an event. So, the first thing that matters is how individuals perceive the event, condition, or action. This is called internal reinforcement. For example, if someone enjoys eating ice cream, they will see it as a positive thing. On the other hand, if someone hates spiders, they will see encountering a spider as a negative thing. So, ano naman external reinforcement? So, an external reinforcement refers to society's evaluation of an event. So, this is how society or culture view something. For example, getting good grades in school is usually seen as a positive by society. So, it can be a form of external reinforcement. So, these two types of reinforcement can either align with each other or conflict. So, pwede nyo sila mag-align or mag-conflict ini nga internal and external reinforcement. So, what is reinforcement sequence? So, reinforcement, which are rewards or positive outcomes, usually come in sequence that connected to future rewards, which ROTTER referred as cluster of reinforcement. So ROTTER believed that reinforcement usually come in a sequence or clusters, right? So this means that one rewards leads to another, creating a chain of positive outcomes. For instance, if you do well on test, you might feel more confident and motivated to study even harder for the next test, leading to even more success. So, amo ito ang reinforcement sequence or cluster of reinforcement. Now, let's go to fourth na variables of specific behaviors, predicting specific behaviors, the psychological situation. So, psychological situation is the part of external and internal world to which a person is responding. So, this refers to the combination of external and internal factors that influence how a person reacts or responds to a particular situations. For example, imagine you're feeling stressed because of deadline at work, at school or at work. This feeling of stress is part of your psychological situation, which can affect how you perform and make decisions in that situation. So, how we predict this behavior? So there are the so those are the four specific prediction. So those are the four specific prediction. So let's move on to basic prediction formula. So basic prediction formula, hypothetically in a specific situation, behavior can be predicted by the basic prediction formula, which states that the potential for a behavior to occur in a particular situation in relation to a given reinforcement is a function of people's expectancy that behavior will be followed by the reinforcement in that situation. So, ang pagbasa sini is behavioral potential is a function of expectancy and reinforcement. So, amo ni siya ang basic prediction formula. Because of precise measurement of each of these variables may be beyond scientific study of human behavior, ROTTER proposed a strategy for predicting general behaviors. So now let's discuss how we predict general behaviors. So in predicting general behavior, there are two types, the generalized expectancies and the needs. So now let's first discuss the generalized expectancies. So to make general predictions of behavior, one must know people's generalized expectancies based on similar past experiences that given behavior will be reinforced. So generalized expectancies. So this is the generalized expectancies. And the other one is the needs. Needs are the basically things that we believe will help us reach our goals. So it is a set of behaviors that people see as moving them in a direction of a goal. So mo nini siya, needs are those things nga nagbubulig sa ato na ma-reach our goals. So what are those needs? So there are 6 categories of needs. The first one is recognition status. This is for the people to be acknowledged and respected by others. This need for recognition and status is something that many people feel strongly about. The second one is dominance. In simple terms, dominance means wanting to be in charge or control how others behave. Domination. So, the third one is independence. So, independence is the feeling of being able to make your own decisions and not to be controlled by anyone else. It's about being free to do what you want without someone else telling you what to do. So, amaton and independence. Next is protection dependency. So, this is the basic human needs, protection dependency. Protection and dependency. Protection means feeling safe and secure, like when someone looks out for you and keeps you out of harm's way. And dependency, on the other hand, is when you rely on others for support and help, like when you need someone to take care of or provide for you. And the third one is love and affection. Fifth, love and affection. This is about how most people have a strong desire for love and affection. This means that people want to feel accepted and cared for by their by others, not just recognized or respected. And the lastly is physical comfort. So physical comfort is a fundamental need that we all have. It's like the foundation of our other needs. When we feel physically comfortable, it's easier for us to focus on other things like learning or socializing. So those are the 6 categories of needs. Get it? So now let's proceed to need components. So need complex has 3 essential components: need potential, freedom of movement, and need value. These components are analogous to the more specific concept of behavioral potential, expectancy, and reinforcement value. So what is need potential? Need potential is a set of functionally related behaviors directed towards the satisfaction of similar goals. So, it is a possible occurrence of a set of functionally related directed towards satisfying the same or similar goals. Example, if someone is hungry, their need potential might include behaviors like looking for food, cooking a meal, or ordering takeout to satisfy their hunger. So, medyo may pagkaparehas-yasan behavioral potential. But behavioral potential is kung ano imo possible actions. So, ngan iba-iba. So, let's move on to freedom of movement. So, freedom of movement is a person's overall expectation of being reinforced. So, it is our behavior is influenced by what we expect will happen as a result of our actions. Example, if you believe that studying hard will lead to good grades, you have a sense of freedom of movement in your academic life. Gets? Okay, now let's move to need value. So, need value, people prefer one set of reinforcement to another. So, it refers to the importance or worth of something based on how much it is needed or desired by a person or a group of people. In simple terms, it is how much something is valued or wanted by someone because it fulfills a specific need or desire. For example, imagine you are thirsty and you see a bottle of water. The need value of the bottle of water would be high because you really need it to quench your thirst. So now let's move on to general prediction formula, which believes that needs potential is a function of freedom of movement and values. So, now let's move to internal and external control of reinforcement. So, internal and external control scale, or popular called as locus of control scale, attempts to measure the degree to which people perceive a causal relationship between their own efforts and environment consequences. So, internal and external locus of control, simple terms, is how people view control of their lives. Some people believe that they have a lot of control over what happens to them, and they think that they can make things happen through their own actions. This is called internal control. So, on the other hand, if some people feel like they have little control over what happens to them, and they think that outside forces like luck or other people's action determine their life, this is called external control. So, if you believe na mas dako imo control sa kung ano na itabo imo, may tawan internal control. Pero kung you believe that mas dako ang control sa ibang nga tao kung ano nahitabo imo, amo ito ang tawag nga external control. So now let's proceed to interpersonal trust scale. So the interpersonal trust scale measures the extent to which a person expects the word or promise of another person to be true. So interpersonal trust scale is a tool used to measure how much trust people have in others. This scale helps researchers understand how comfortable someone is with relying on others and believing that they will act in a trustworthy manner. For example, imagine you have a friend who always keeps your secret and shows up when they say they will. So you would likely have a high level of interpersonal trust in this friend because they have consistently shown themselves to be reliable and trustworthy. So now let's proceed to maladaptive behavior. So Rotter defined maladaptive behavior as any persistent behavior that fails to move a person closer to a desired goals. So maladaptive behaviors is any behavior that doesn't help a person get closer to achieving their goals. This means that a person continues to do things that don't actually help them succeed or reach what they want. For example, let's say someone wants to get a good grade or a test, but instead of studying, they spend all their time watching TV. This behavior is considered maladaptive because it's not helping them to get closer to their goal of getting a good grade. So how we avoid maladaptive behavior? So Rotter's therapy. The goal of Rotter's therapy is to achieve harmony between clients' freedom of movement and need value to avoid the maladaptive behavior. So, Rotter believes that the main goal of psychotherapy is to help people change their behavior by working with another person. So, this process involves learning new ways of thinking and acting in a social setting. So, essentially, psychotherapy is about helping individuals improve their behavior and interactions with others through guidance and support from a therapist or a counselor. So, what are the psychotherapy of Reuters? So, to avoid maladaptive behaviors, Reuters said that we must follow the following steps or instructions. The first one is changing goals. So, maladaptive behaviors follow from three categories of inappropriate goals. So, the first one is conflict between goals, the second one is destructive goals, and the third one is unrealistic, loofy goals. Many unmet ang mga maladaptive behaviors. So, paano tayo may iwasan? We have to pursue them to change their goals. So, some people struggle to solve their problems because they have goals that are not helpful or realistic. So, the therapist or as job is to show these people that their goals are not working and help them come up with help the, not working and help them come up with better ways to reach their goals. So ipaparealize to sa era that their goals is not helping them and i-introduce to sa era, bubulikan ta sa era to change their goals in more realistic goals. The second one is eliminating low expectancies. So, reinforcing positive behaviors, ignoring inappropriate behaviors, and giving advices, etc. So, in eliminating low expectancy, therapists work to help patients have low expectation of success and feel restricted in their action. This can happen for a few different reasons. For example, someone might feel like achieve their goal because they don't believe in themselves. So they might feel like they are limited by their circumstances or past experiences. So ano tatanihin mo para ini ma-change? So the therapist try to change these negative beliefs and help patients see that they have the ability to succeed and make positive changes in their lives. So by doing this, they can help patients feel more confident and empowered to make control of their lives. So ini is we just pursue any limiting low expectancy. We just pursue them and encourage them that they can achieve that goals na ito na more realistic goals na kaya to nera himuon, and they have a freedom to make their own decision nga kaya nera to himuon, nga kaya nera to ma-achieve na era goals basta dere as long as dere sila mag-set sa high standards and more realistic ini na goals na era ni ada. So now, igahatag ko na an floor kan Ate Diana to discuss kan Walter MISCHEL theory.
So, let's move on to Walter MISCHEL theory, the cognitive affective personality system, also known as CAPS. So, may pagkaparehas inihiyahan kan ROTTER theory in terms an ira goal in predicting behavior. Pero, bagan medyo complex laan kan MISCHEL kay ginapi niya ang trait theory. So, kung hi ROTTER, naghimoyahin formula para i-predict an specific and general behavior using the psychological situation. Hi MISCHEL and Shoda naman is mas karuyag nira nga maiapi ang global trait and factors nga na-discover ni Ace, Nick, and Alport. So, the cognitive affective personality is a psychological theory proposed by Walter MISCHEL and Yuichi Shoda in 1995. So, according to this theory, behavior is the best predicted by understanding the person, the situation, and the interaction between the person and the situation. So, the CAPS theory emphasizes that behavior is not solely determined by global personality trait, but rather by how individuals perceive themselves in a specific situation. So, inconsistencies in a behavior are attributed to stable pattern of variation within the individual rather than solely to external circumstances. So, let's find out what really cognitive affective personality system is. So, before that, let's find out who is Walter MISCHEL. So, Walter MISCHEL was born in 1930 in Vienna, the second son of upper middle class parents, and when the Nazis invaded Austria in 1938, his family moved to the United States and eventually settled in Brooklyn. So, he received a MA from City College of New York and a PhD from Ohio State, where he was influenced by Julian ROTTER. So, he is a professor of Columbia University. So, during his academic journey, he developed the CAPS or Cognitive Affective Personality System. So, a theory as a significant contribution to the psychology of personality. So, MISCHEL believes that cognitive factors such as expectancies, subjective perceptions, values, goals, and personal standard are more important in shaping personality. In this early theory, MISCHEL seriously questioned the consistency of personality. But more recently, he and Shoda have advanced the notion that behavior is also function of relatively stable personal disposition and cognitive affective processes interacting with a particular situation. So, the theory emphasizes the role of cognitive factors such as expectancies, subjective perceptions, values, goals, and personal standard in influencing the personality. So it highlights the dynamic interaction between individual and their environments, and also suggesting that behavior is not solely determined by fixed personality trait, but it is also influenced by cognitive processes and situational factors. So, initially, Michel's questioned the consistency of personality trait, um, challenging the traditional notion of stable personality characteristics. However, over time, Michel's and Shaw advanced the idea that behavior result from the interaction of relatively stable personal disposition and a cognitive affective processes with a specific situation. This shift in perspective acknowledged the importance of both stable individual traits and situational factors in shaping behavior. So, Michel originally believed that human behavior was mostly a function of the situation, but presently he has recognized the importance of relatively permanent cognitive affective unit. So, he's criticizing the perspective of trait psychology by saying that if we want to know how a person will behave, let's not only look at the trait, but also need to look at the feature of a certain situation. So, what makes the situation unique or what make the situation different in contrast to other situation? So, right now, let's take a look at consistency paradox. So, consistency paradox refers to the observation that although both lay people and professionals tend to believe that behavior is quite consistent, research suggests that it is not. Michel recognized that indeed some traits are consistent over time, but he contend that there is little evidence to suggest that they are consistent from the situation to another. So, this is what Michel labeled as the consistency paradox. How does his proposition, how does his belief differ in contrast of a trait psychology? So basically, kung trait psychology ka, you will assume that an extroverted person is supposed to be an extroverted individual in all situation. However, for Michel, there might be a situation which you are sociable or might be a situation that you are quiet, and some trait psychology would say na that's not supposed to happen. But for Michel, he would say that there is a changes in our behavior not because of mistake and prediction, but rather there are changes in our behavior because we should also look at the situation. So if the situation changes, then the behavior might change as well. So, because of a situation A might not be the same as the situation B. That's why it's a paradox. You are consistently different in a various situation. So he contended that the some basic trait do not persist over time, and that was being claimed by a trait psychology. So, Michel, he doesn't really believe that they do persist over time, but there are some evidences exist that they generalize from one situation to another. And we have also a person situation interaction. So Michel believes that behavior is best predicted from underlying of a person, the situation and the interaction between person and situation. Thus, behavior is not the result of some global personality trait, but people perception of themselves in a particular situation. So, he have some inconsistency in their behavior, but he continued to insist that the situation has a powerful effect on the behavior. So like what I've said earlier, it's not just a trait that we should look at. We should also look at the situation. How does it influence our behavior, our attitude? In that situation, for example, a student may have a history of being conscientious with regard to academic work, but but failed to conscientious in a cleaning her room or maintaining the cleanliness in working conditions. Okay, so a trait psychologist would say that that's not supposed to happen. If he is consensual, then he's supposed to be conscientious in all situation. However, for Michelle, he would argue that it's okay if you're not consensuous in all situation because situation A is not the same as situation B, and that is once again what we call is consistency paradox. So Michelle does not believe that inconsistencies in behavior are due to solely to the situation. He recognized that inconsistent behavior reflect stable pattern of variation within a person. He and Shoda see this stable variation in behavior in the following framework: if A, then X, but if B, then Y. So, people pattern a variability in their behavioral signature of personality or their unique and stable pattern of being differently in different situations. So, excuse me. For example, behaviorists argue that situations are the ones that predict our behavior. So, in the perspective naman ni Michelle, he would argue that it is not the situation itself that produces behavior, but rather there is something in between, and this is not what this is what we called a cognitive units. So in other words, before you do something in a certain situation, dapat anay naton isipon na kung ano ba talaga tatihimuon. So, basically, Michelle is trying to tell us the situation A is different in contrast a situation B because there are different features, there are different components in a certain situation. So, for example, my behavior when I am with my mom is different when I'm not with my mom. So obviously, the component of situation A has changed because my mom is not longer present in a situation B. So that's what Michelle want to tell us. So we have a behavior prediction. So behavior prediction is a stable system that processes information about the situation. Then individuals encountering different situation should believe differently as situations vary. So behavior prediction refers to the processes of anticipating or forecasting how individual is likely to behave in a given situation based on the various factors such as personality traits, past experiences, cognitive processes, and the specific circumstances of the situation. So, a behavior prediction aims to understand the forecast human behavior to make informed judgment or decision. So, next is the situation variable. So, it is the situation variable include all those stimuli that people attend to in a given situation. So, it is refers to the external factors or circumstances that influence an individual behavior in a specific situation. So, these variables can include the physical environment like social context, social norms, cultural influences, and other situational cues that impact how person respond or behave in a given setting. And the third one is the cognitive effective units. So, it is include all the psychological, social, and physiological aspect of a people that permit them to interact with their environment with some stability in their behavior. So, this unit represent the psychological, social, and physiological aspect of individual that enable them to interact with their environment in a relatively stable manner. So, the cognitive affective units play a crucial role in shaping behavior. So, like an emotion, and cognitive processes in response to different situation. So, here are some 5 mediator unit of MISCHEL. First is the encoding strategies. So, people's individualized manner how categorizing information they receive from external stimuli. So the encoding strategies, in layman's term, how did you encode the situation or an event? So, for example, if someone insulted you, will you react angrily or will you ignore it? Or so of course, you would say that it depends on a situation. So basically, that's what Michelle trying to tell us. Our behavior is depend on the situation, but it also depend on how we interpret or encode the situation. So you need to pay attention on how you encode this situation. So next is the competencies also. Competences and self-regulatory strategies. So this is one of the most important of these competencies is intelligence, which Michelle argues is responsible for the apparent consistency of the other trait. So it was also influence our behavior. So do you think you'll be successful in what you're doing? Do you think that magiging successful ka kung like i-pursue mo an psychology, i-pursue mo an magpagiging teacher, magiging successful ka ba in the future? So, asya iton kabagan karuyag sidnganhan self-regulatory strategy. So, for example, like a person may feel confident in one subject but not in another because you think that you are competent in one subject but not in another. You think you're competent in one subject and you think you're not that competent in another subject. That may influence our behavior. Magiging kuan niya. Mas dako yan inconsistency ha situation. So the other one is the cognitive effective units are expectancies and beliefs. So people guesses about the consequences of each of the different behavioral possibilities. So here is our expectations, our beliefs in a certain situation. Mas nagfo-focus kita didihan aton mga expectation and belief. So for example, a student is preparing for a licensure exam may think that it's difficult because his previous experiences in taking exams. Bagan an iya expectation nga bagan makuri an pag-exam tungodhan mga previous nga iya na experience nga exam. So nag-expect hiya nga magiging makuri gihap ang pagkuwahan licensure exam. So your expectation of what will happen in the future is partly influenced by your past experiences. So the third one is the goals and values. So which tend to tender behavior fairly consistent. So when we speak about goals and values, so people do not react passively to situation, but rather are active and goal-directed. And we differ in a contrast to each other because we also have different goals, we have different values. So, for example, two college students may have equal academic ability and also equal expectancy for success in graduate school. What differentiate them? The first one, however, places more value on entering the job market than on going to a graduate school, while the second one chooses to go to go to graduate school rather to pursue an immediate career. So they have some ability but they have different values. So that's why we behave differently in a contrast to the people around us. And the last one is the affective responses. It including emotions, feelings, and affect that accompany physiological reaction. So finally, he didn't forget the rule of affect, feelings, emotion, and believes that our emotions. I mean, he believed that our emotion overlap with our thinking. So, for example, if you say something like this to yourself na, I see myself as a competent psychology student and that pleases me. So, if your belief makes you happy, then another then you're going to meet that belief. Kung ano nim gintutuuran nga bagan feeling mo magiging goods, magiging maupay ang responses ito na imo pag nga imo belief, hihimuon mo talaga. So I have another example here. I mean, the rule of effect of our behavior is that when you are panicking, like panicking, or when you are not in the right state of mind, you are not thinking logically, when you are going to be impulsive in the things that you do, but when you're going to be more rational, I mean, magiging impulsive ka tungod han imo behavior nga ginpapakita. And then bagan pag if you calm down, think about things for a while before nga mag-make ka hin decision, kay baganda kon iya magiging influence haaton pag-response through aton behavior. So like before you making any decision, then you're doing to be more rational. That's why we try to tell people when they are angry, try to calm down first before you do anything, because your feelings influence your behavior. So that's what affective responses is. So that's it. Thank you for your time and attention. I hope you found this presentation informative.